Stick it in there, and then you make sure that this little thing when you turn it on actually says 4. And this little screwdriver hole can let you adjust it. Okay, so I did that, and then I started testing these mouth rinses. I told you that the roots of your teeth dissolve at 6.5. What I didn't tell you was the enamel of your teeth dissolves at 5.5. This is why this would be really bad, because this has a pH of 5.5. If you rinse with this before you go to bed at night, you are going to dissolve the minerals out of your enamel. You are going to cause erosion up at the gum line. This would not be helpful. However, and scope is the same, virtually. What would be even more distressing is if you had dry mouth and you'd spend the more expensive one that's heavily advertised for dry mouth has a pH of 5.4. That's even more acidic. Why would you want that? I knew it didn't work, now I know why. But you could go and buy the even more expensive one that you totally believe because it's good old Mr. Tom, except it's made by Colgate now, you know that.
No, I didn't know that.
Yeah, bought Tom's a decade ago. And when we put the pH tester in this one, which is much more expensive, looks so nice, and you're trying to avoid all the fluoride and everything, right? The pH of this is 3.3. That is like rinsing your teeth with with diet soda before you go to bed at night. Why would you do that?
Because advertising told us to.
And Listerine? Listerine is 4.2. I'm going to show you how to use Listerine because I like it, and I'll explain why in the next 15 minutes. But don't let anyone you love use these things alone. It's you know what I mean?
It's your mouth alone.
Just so you know, you're on the same par as maybe drinking some lemon juice before you go to bed at night. And pH whitening strips and things, they're down in the pH 1, something like that.
Oh my goodness.
Why do they do this? They do this because they know that you want whiter teeth. And so when you look in the mirror and your teeth are white, you are a happy person. Your teeth are artificially whitened by the acidity because if you wanted to frost your glass there, do you know what they would do? They would etch the glass. They would come with some acid and they would etch the glass. Your happy mouth rinse companies are etching your teeth for you because they know you want to wake up with nice white teeth. The trouble is when your teeth are etched, they are more likely to stain, they are roughened, the acidity is promoting gum disease bacteria and all the bad things and the tartar buildup and everything else in your mouth. And you're also just, so that there's nothing good about it. Your teeth are going to be more sensitive. Of course, they do make the sensitive stuff that's going to dry your mouth so that you'll be back. You've got to get off the bandwagon here. Otherwise, you'll be going in circles for the rest of your life. And that's sort of where I bring myself now to the last part of this very quick program. And I'm really flying through it because of the time. And I discovered that if you use certain mouth rinses, you will be able to control all these bad things in your mouth. Before you brush your teeth, you would ideally want your mouth to be alkaline. And this great little product that you may or may, and don't write it all down because we've got booklets we can give you with everything in it. Just listen right now. Closis is a product. These are nothing I make. These people are not particularly even nice to me. Because they have their own toothpaste and they want you to use it a different way. And they have a whole agenda that doesn't fit with mine. But this is a great product. Use it as a pre-rinse. Gentlemen, I'm just going to talk to the ladies for a minute. This is like deep cleanser for a skincare program. This is like your first deep cleansing. Let's get the bacteria corrected. This is what this does. It's actually a tremendous surfactant. It goes down between the tooth and the gum. If you have been told you have pocketing, this is what you need. Bathe the pockets, if they're at the back of your mouth or if they're at the front, tip your head around so that the liquid gets 1 minute, not more, not less. 1 minute. Stopwatch. 1 minute. 30 seconds, it reacts with your saliva, goes down these little crevices, nooks and crannies, turns to oxygen. Remember what I told you? Those bad bacteria are anaerobic. They hate oxygen. You're good guys, go bring it on. We're happy. So you get rid of the only bacteria that you're really targeting, the bad anaerobic bacteria. And it does a really good job of most of them. Okay, we'll talk about the one that gets left behind. The minute you've done that for 1 minute, we now need to brush your gums. And as I mentioned earlier, use a smallish toothbrush because I want you to go, like the Miswax stick, right up on the gums. None of this sort of tiddling around, 45-degree angle.
Yeah.
I just say, I'm sorry, excuse me. This works. We want to get the circulation going in the gums. On the outside, on the inside, right at the back, if you could possibly get your toothbrush there without throwing up. And the same at the bottom. And you may have to close your mouth. You may have to do some gymnastics. You may have to really figure out how small you have to go with your toothbrush. Get a youth one, get a small one. But get around the gums. And if it's down the bottom here and you've got a tight lip or you've got things going on up here, you've got to get everywhere. I usually can tell if somebody's left or right-handed because they will brush, turn their wrist around, and they'll miss these 3 teeth here.
Oh, funny. Does the Sonicare help that?
Only if you put it in the right place. It's just a little easier because it's doing the vibration, so it's getting the circulation going by vibrating your head. I mean, the thing is,
The toothbrush head.
and your own head, your circulation. Our goal is to get the blood flow to the teeth by massaging the gums with your toothbrush on the inside and on the outside of the upper and lowers. We are not trying to clean our teeth with a toothbrush. We are not even trying to go down the... We are not...
Whole idea.
We are gum massaging. We are not even trying to get the bristles of the toothbrush down the crevice between the tooth and the gum. That went out about 20 years ago, and I can explain the history of all of that. We are simply trying to get circulation going. We are trying to not hurt our gums, but don't just tickle them. Circulate it. Work around. You are going to transport good toothpaste on your toothbrush, and this is the toothpaste I recommend, the real old-fashioned Crest. Not because it does anything to your gums, basically because it doesn't.
Okay.
Don't go and please don't buy the latest and greatest xylitol toothpaste because usually they're too abrasive. And they have the wrong ingredients for what I want you to do. I love xylitol, but I don't recommend xylitol in this particular program. This is the toothpaste that goes with this program. And while you've got it on your toothbrush, by all means, go over the teeth just to make yourself feel happy. And you are applying a useful toothpaste to the enamel. Because in this toothpaste is the calcium and the phosphates and the silica. The 3 things that make up the components of glass. The glass helmet can use these ingredients to mineralize. If you read very carefully, this toothpaste has always, since the 1960s, told you that it helps stop cavities before they start. Interpret that in your head for a second. Isn't that exactly what we're trying to do?
Yes.
So you want what this offers. And I can explain the bad things that you think you don't want. In here is fluoride. I am an anti-fluoridationist. I have tried to get fluoride out of the drinking water. I've poisoned 2 of my daughters with fluoride so that they had bad thyroids and trouble conceiving. I fully am against fluoride, except in this toothpaste and in this mouth rinse that I'm going to tell you about. And you will spit it out, and you will not be ingesting it. You will not even absorb it, because you remember, you've just put it on your toothbrush. You've got about the size of a pea. You've been around here. You've been on your teeth, and if and you've done this. Now you're going to rinse it right off, and you're going to rinse it off with Listerine, which is another horror shock to people because I just said it's pH 4.2. Worse yet, it's got alcohol in it. But we need it because in Listerine is eucalyptus, menthol, and thymol. 3 essential oils that will pop the bacteria that we don't want, which are the immature bacteria of plaque. When plaque is a baby, it is a seed. After 12 hours, it grows into a thing, a bit like a butterfly comes out of a chrysalis. Out of this little seed grows a little caterpillar type thing. That is your plaque bacteria. Your plaque bacteria are really wormy little things that stick on your teeth. But when it is loose and roaming around in its first 12 hours, it's a little round ball. And xylitol is most effective for the caterpillary mutans, the plaque bacteria that are mature. It is ineffective with the seeds because it is coated in a hard outer seed.
The bacteria.
Yes, that immature